Take a breath with me for 3 seconds. In, hold, and out. If you're here, there's a good chance you've been feeling things that don't quite add up. Little waves of heat for no clear reason, a heart that suddenly races like it got a surprise text, sleep that used to be your superpower but now flips you awake at 3 a.m. And maybe the most frustrating part is that when you Google it, you see the same old cliches. Tonight, I want to do something different. I want to talk to you like a friend who's done the homework. We're going to walk through 14 sneaky symptoms that many women experience around menopause, but don't always recognize why they happen. How to tell them apart from other issues, what you can do safely at home, and when to call your doctor. No drama, no shame, just clarity, kindness, and a plan you can actually use. First, a quick map so the rest makes sense. Menopause isn't a single night and day switch. It's a timeline. Perimenopause is the warm-up, sometimes years of shifting hormones and irregular cycles. Menopause itself is defined after 12 months without a period. Postmenopause is everything after that anniversary. Your experience may not match your sister's or your mom's, and that's normal. Hormones, genetics, stress, sleep, nutrition, and medical history all shape your path. That's why two women can be the same age and feel completely different things. Why do so many symptoms stay hidden? Because the spotlight usually lands on hot flashes, and yes, they're common, but not the whole story. A lot of what you feel in this season overlaps with everyday life. Stress from work or family, nutrient gaps, or just the world. Add the fact that many women are incredibly good at powering through, and it's easy to miss the pattern. So if anything I say tonight sounds like your life, you're not imagining it. Let's uncover those 14 symptoms, and as we do, I'll give you simple ways to respond. Keep a little mental checklist as we go. 1. Brain fog. You walk into a room and think, why am I here? Names and words slip away for a second. It's not the same as progressive memory loss. This is attention and recall hiccups tied to hormone shifts, stress, and sleep debt. You're not losing it. Support your brain with steady protein at each meal. Move your body daily and protect your sleep window. A simple trick. Keep a capture pad, paper or notes app, where you jot tasks as they pop up. Your brain relaxes when it knows it won't drop the ball. 2. Heart flutters or a brief skip. Sudden palpitations can be alarming. Hormonal changes can increase your sensitivity to normal heart rhythms. That said, any new chest pain, breathlessness, or fainting is a red flag. Don't wait. Get checked. For benign flutters, notice patterns. Caffeine late in the day, wine close to bedtime, dehydration. Try 4-6-8 breathing for 1 minute. Inhale for 4, hold for 6, exhale for 8 to calm your nervous system. 3. Sudden anxiety or even a panic surge that seems to come out of nowhere. You're not weak, and you didn't catch anxiety. Hormone receptors live in your brain too. Ground yourself with a name it game. I see the blue cup, I feel the chair, I hear the fan. You're telling your body, I'm safe. If these episodes are frequent or severe, speak with a clinician. There are effective non-habit-forming options and therapy skills that work. 4. Sleep that turns into a puzzle. Trouble falling asleep, waking up at 2 or 3 a.m., or a partner whispering that you snore or pause breathing. This isn't just annoying. Chronic sleep loss amplifies every other symptom. Create a gentle wind-down. Warm shower, dim lights, no heavy meals late, and screens out of the bedroom if you can manage it. Keep the room cool. If snoring or pauses happen often, ask about a sleep study. Treating sleep apnea can be life-changing. 5. Joint aches and morning stiffness that make you move like the Tin Man for the first 10 minutes. Estrogen affects connective tissue and inflammation patterns. Gentle mobility when you wake up, daily walking, and 2 or 3 short resistance sessions per week can reduce stiffness. Think simple. Body weight squats to a chair, wall push-ups, light dumbbells if you have them. 6. Digestive plot twists. Bloating, constipation, or a suddenly sensitive gut. Hormonal shifts influence motility and gut bacteria. Aim for fiber from real food. Vegetables, berries, oats, beans if tolerated, and drink water steadily through the day, not just at night. If certain foods cause predictable flares, try a 2-week experiment to observe, not punish. Pro tip: slow down at meals. Digestion starts in your mouth. 7. Dry or irritated eyes and a subtle change in focusing. Hydration helps, but many women benefit from preservative-free artificial tears and a 20-20-20 screen break. Every 20 minutes, look 20 feet away for 20 seconds. If you wear contacts, keep them clean and consider shorter wear time during flare days. 8. Ringing in the ears or sound sensitivity. It's not the most common symptom, but it happens. Track when it starts. After a poor sleep, after wine, stress spike. Gentle background sound at bedtime can help mask ringing. So can breathwork that relaxes neck and jaw tension. 9. Skin, hair, and nail changes. Dryness, itching, faster fine lines, hair shedding that feels like more than seasonal. Support from the inside out matters. Adequate protein across the day, omega-3 rich foods like fatty fish, and consistent hydration. Outside in, moisturize right after showering. Use gentle cleansers, and consider a humidifier if your air is dry. For scalp concerns, a dermatologist can check for treatable patterns early. 10. Mouth and gum sensitivity, dry mouth, or new tooth sensitivity. Saliva changes with hormones. Sip water often, chew sugar-free gum to stimulate saliva, and keep up with dental checkups. If your gums bleed when you floss, don't stop flossing. Be gentle and regular. Your dentist can suggest targeted rinses that protect enamel without harshness. 11. Mood swerves, irritability that shocks you, tearfulness out of the blue, or feeling flat. This is real chemistry plus real life. Movement is medicine here. 10 minutes of brisk walking can shift brain chemistry. Sunlight early in the day helps regulate circadian rhythms. And if your mood consistently dims your days, talk with a professional. You deserve lightness. 12. Changes in intimacy, lower desire or discomfort due to dryness. You are not broken. Local moisturizers and lubricants can change the experience dramatically, and there are low-dose local treatments, prescribed, that act mostly where they're needed. Communicate with your partner. Curiosity beats pressure every time. 13. More frequent urination or urinary tract infections. Pelvic floor strength and local tissue changes both play a role. A pelvic floor therapist can teach you tailored exercises that go far beyond the old "just do Kegels" advice. Don't tough it out if symptoms suggest an infection. Early treatment prevents complications. 14. Weight distribution shifts, especially around the belly, even if your habits haven't changed. It's not a moral failure. Hormones alter where your body stores energy. Strength training becomes your best friend here. Muscle is metabolically active and protective. Think 2 to 3 short sessions weekly, plus walking most days. Focus on consistency, not punishment. Now, how do you tell a hormone story from something else? Patterns help. If several symptoms arrive in the same season of irregular cycles, or the first year after your final period, hormones are strong suspects. But keep a wide lens. New or severe chest pain, one-sided weakness, speech changes, heavy bleeding after menopause, fainting, or the worst headache of your life. Those are red flags. Don't self-diagnose. Get urgent care. For the day-to-day murky stuff, basic labs can rule out common mimics. Thyroid problems, low iron, blood sugar issues. This isn't about finding something wrong. It's about giving yourself information. Let's talk about what you can safely try at home because small, consistent changes stack up. Guard your sleep like it's an appointment. Go to bed and wake up at roughly the same times, even on weekends. Keep the room cool and dark. Park caffeine earlier in the day. If your brain revs at bedtime, write a 2-minute brain dump of tomorrow's tasks and give your mind permission to rest. Build your plate like this. A palm-sized protein source each meal. A big handful of colorful vegetables. A fist of slow carbs like oats or quinoa or beans if they love you back. And a thumb of healthy fats like olive oil or nuts. Protein helps with fullness, skin and hair repair, and paired with strength training, muscle maintenance. Fiber steadies blood sugar and supports the microbiome. Highly processed foods don't make you bad. They just make energy regulation harder right now. Think addition, not restriction. Move your body most days. If the gym isn't your thing, start at home. 2 sets of 8 to 12 chair squats, wall push-ups, and a plank you hold as long as you can with good form. That's it. Add minutes or a third set when you feel ready. Movement is not a punishment for what you ate. It is a gift to your future self. Manage stress like a skill you can practice. You don't need an hour on a mountaintop. Try 1 minute of slow breathing before meals. Take a 10-minute outside walk after lunch. Write down 3 small wins at night. Replied to that email. Drank water. Called a friend. Your nervous system loves signals of safety and progress. What about supplements? Think targeted and tidy, always after a chat with your clinician, especially if you take medications. Vitamin D if you're low, with calcium from food or modest supplementation to support bones. Magnesium glycinate in the evening can help some people with sleep and muscle tension. Omega-3s if your diet is low in fatty fish. Be cautious with big promises and mega doses. More is not more, and some supplements interact with medicines or aren't appropriate for certain conditions. Keep it simple and evidence-guided. On the medical side, there are tools worth discussing with a trusted provider. Hormone therapy can be a good fit for some women when started within a certain window. It has potential benefits and risks that depend on your personal and family history. If it's not right for you, non-hormonal options exist to ease hot flashes, sleep issues, and mood symptoms. Local treatments for vaginal dryness often act where they're needed with minimal whole-body effect. This is individualized care, not a one-size-fits-all prescription. Let's sweep away a few myths while we're here. It's all in your head. No, it's in your biology, which includes your brain. You can't build muscle at this age. You absolutely can. Your timeline might be slower, but your body is responsive. Hormones are always dangerous. Not always. The right choice depends on timing, type, dose, and your health profile. Once weight shifts, you're stuck. Not true. Strength training, protein timing, sleep, and stress skills change the game over months, not days. I want to leave you with a 5-step plan you can start tonight. 1. Start an energy and symptoms log for 4 weeks. Nothing fancy. Date, sleep quality, movement, what you ate roughly, how you felt, and any standout symptoms. Patterns will pop out. 2. Book a check-in with your clinician and bring the log. Ask about basic labs if symptoms are confusing. 3. Commit to a 30-day habit experiment. Consistent sleep window, daily walk, 2 strength sessions per week, and a protein plus fiber breakfast. 4. Reassess after 4 weeks. What improved? What didn't? Adjust one variable at a time. 5. Schedule a 6-month follow-up for bone health, heart risk factors, and any ongoing symptoms that deserve a second look. If you're still with me, let me say this clearly. You are not overreacting, you are not making it up, and you are definitely not alone. Your body is adapting to a new hormone environment, and while the path is different for everyone, the tools to navigate it are real. Talk to people who take you seriously. Share this knowledge with a friend who keeps saying, "I'm just tired, it's nothing." It might be something, and that something is understandable and manageable. Before we wrap, scan your own checklist. Did you hear yourself in brain fog? In the heart flutters after coffee? In the 3 a.m. wake-ups, the bloating after certain meals, the dry eyes at your desk, the sudden tears, the shifting shape in the mirror? Pick one area to act on this week. Not 10. 1. Maybe it's a lights-out time 30 minutes earlier, a 10-minute walk after dinner, or finally booking that appointment. Small wins compound. And now I'm going to do the most unexpected thing in a health video. I'm stopping mid-sentence, right when your brain is waiting for a tidy bow. So you remember this moment, the next time your heart skips and you think, wait, I learned what to do.